Is part of the Safe States Pedestrian Safety Action Team Program. My name is Hal Hagedorn, and I manage the Initiative for Bicycle and Pedestrian Innovation at Portland State University. And I will be your moderator for today. We are pleased to be able to help host this training and mini grant opportunity along with our colleagues from Commute Options, the Oregon Health Authority, the Oregon Department of Transportation, Oregon Walks, and Washington County. Our speakers today are Heather Grant, who is a policy analyst, and Adrian Green, a program manager with the Oregon Health Authority. We also have Lidveen Rahman, a board member of Oregon Walks, as well as a planner with the Oregon Department of Transportation. We have Kim Curley with Commute Options, Shelley O'Lear, the Bicycle and Pedestrian Coordinator with Washington County, and last but not least of all, we have Sheila Lyons, the Bicycle and Pedestrian Program Manager with the Oregon Department of Transportation. Before we begin, I would like to point out that if you are tracking any professional development credits, the entire webinar, this first session as well as the second session, qualifies for 3 credit hours. If you have questions during the webinar, you should submit your questions to our speakers using your question pane, which you should see in the right-hand window of your screen. We will collect the questions during the webinar, and the speakers will respond to them at the end of each webinar session. So before I hand things over to Heather, I have a quick poll to help our speakers better understand who is tuning into the webinar. So you will see on your screen just briefly. Okay. Give me a second. So our first question is, we want to know what discipline and/or organization type best describes your work. So please select from the following options on your screen. Are you in the public health area, public safety law enforcement, transportation planning and/or engineering, city regional land use planning, or bicycle and pedestrian advocacy? So I'll just wait a moment for folks to enter in their answers. So it looks like 82% are voting. Wait a couple more seconds. All right, I'm going to close the poll. And here are results. So the majority, 64% of you, are from transportation planning and/or engineering. 25% of you are from the bicycle and pedestrian advocacy area. And equally distributed with 4% are the last 3 categories: public health, public safety law enforcement, and city regional land use planning. All right, so now I will hand things over to Heather Grant. Just wait a second. Okay. Sorry about this. We are having some technical difficulties. There we go.
Okay, good morning, everyone. Today we're going to spend some time on this important topic of pedestrian safety. And I will say up front, we don't want you to be daunted by the apparent length of this webinar. It's a bit longer than some webinars you're probably used to. But Oregon is a big state, and rather than pre-select communities for this mini grant program and training, this approach is going to enable the team to reach more communities statewide on this topic. So briefly, you can see here what we'll cover today. We're going to let you know about the Safe States program, share some overarching public health framing of this issue of pedestrian safety as a way to approach the work. And then we will dig into some data. We'll also talk about components of a good pedestrian safety approach, and then delve into the 5 E's. And we'll cover 3 of the 5 E's today. We will have a 30-minute break in the middle for everyone. And please note that the webinar is being recorded for later viewing. We will have plenty of time, especially in the second session, for questions and answers. Okay, so why pedestrian safety? Safety, of course, in and of itself, it's pretty self-evident that it's critical. It's a health concern. It's a human concern. No one should be in fear of doing something as natural to our evolution and our being as walking. You're going to hear a bit later about some of the data trends that illustrate how big of a problem safety actually is in Oregon and who's more at risk. But we also want to take a moment here to underscore today that safety serves a secondary function and has a lot of ripple effects. Safety is cited time and again through a variety of surveys across the nation as really the #1 barrier to getting more people walking, and I should add biking as well. And walking is vitally important. Physical inactivity is one of the most powerful independent risk factors for chronic disease, and that's something that Oregon is currently spending about $10 billion on each year, about $4 billion of which is public funding. Most of the health benefits for physical activity would come in the first 30 minutes of moving. And active transportation, compared to any other means that we could get people active, whether it's on the job or at home, active transportation is really, has been identified as one of our best hopes for getting more of us to meet that requirement. So it's not surprising that getting people walking is a top priority for the Centers for Disease Control, and that is why the CDC is also very interested in safety. So connecting the dots that when people feel safe, more of them will shift their mode. And you can see there are a number of other, not only secondary, but many ripple effects in terms of the benefits of pedestrian-friendly environments. We get better air and water quality, reduced greenhouse gas emissions, we get more access to employment and access to goods and services, and more community interaction in walkable neighborhoods and more social cohesion, which has a lot of benefits. Pedestrian safety can't be addressed by one field alone, and there's a lot we can learn from each other across disciplines, and that's why the National Highway Traffic Safety Administration and the CDC have come together to pilot this project. So finally, we're supported in this work knowing that right now Americans and Oregonians are expressing more than ever that they want walkable communities, and so by definition they want safe communities. And we also have support for this work at the top, as seen in federal transportation funding and some comments that are open right now. We're seeing more and more the required performance measures for safety. And as Department of Transportation Director Anthony Fox points out in this quote here so well, this work applies to urban, suburban, and rural communities. And as he says, at some point, everyone is a pedestrian. So a brief overview of the Safe States program. The project that brings you this webinar is the Safe States Pedestrian Action Planning Grant, offered, as I said, by, it's funded through NHTSA and the Centers for Disease Control, or CDC. It was a program offered by the Safe States Alliance, a DC-based nonprofit. 4 states were funded, along with Oregon, Kentucky, California, and Rhode Island were funded. A team of us came together in DC to learn from each other's disciplines and build our knowledge and capacity. And we gave lots of feedback to NHTSA for when they are hoping to scale this up a bit more nationwide. So today we have the webinar to have statewide reach, and after offering this training, mini grants will be available through a brief application process that we'll talk about later. Funded communities over the next year are going to receive technical assistance and consultation and site visits to implement some safe pedestrian safety actions. And there's also going to be an evaluation that's very high level, conducted by the Safe States Alliance. Okay, so that we'll talk more at the end about the mini grants and other details, but let's get into framing for healthy communities and transportation. This pie chart represents what's understood as a truism in the public health community, that medical care, as important as it is, really only accounts for 10% of our actual health status. We don't always stop to think about this, given how much attention there is, especially right now, on the medical care delivery system, but it's true. A public health expert once said an analogy, I think that's helpful, that If medical care caused all health, lack of it would directly cause disease. That's like saying lack of an aspirin causes a headache. Aspirin alleviates headaches, but lack of it doesn't cause it. So the thing that stands out to most people on this slide is behaviors as the biggest piece of the pie at 40% of our health status. But on its face, this isn't the whole story. In the public health paradigm, it's commonly understood that our behaviors are really governed by the settings in which we find ourselves every day, whether it's at work or in our home or our neighborhood. And these settings provide a context and can be health promoting or health limiting. In other words, it's easy or difficult to make a healthy choice. So we typically combine behaviors along with those other two wedges there called social circumstances and environmental exposure to illustrate that it's the physical and the social context in which we live that provide these options for health. And combined, these make up at least 60% of our health status. And this study here has stood the test of time and has been replicated many times. And this combination of the social and built environment consistently make up 60 to 70% of our health status. And people do have an important role to play in taking personal responsibility for their choices. We certainly focus on that as well in public health, and whether that's on preventing disease or being an alert pedestrian in this case. But at the same time, there are many examples that highlight how our choices aren't always as free as we believe them to be. So a bit more on that, more framing from your public health colleagues here. This is known in the public health world as Frieden's Pyramid. Dr. Thomas Frieden is the current director of the CDC, and it shows what we mean by these determinants of health, the social and physical environment, and illustrates the role that transportation can play with a safety example here. What the pyramid shows is that from the top to the bottom, you have a really high concentration of effort and focused more on individuals at the top with counseling and education. And toward the bottom, you are having a broader reach in your efforts and having more population impact. And coincidentally, also there's greater effect. So it's not only efficiency, but effectiveness, typically the further down the pyramid that you work. And so clearly education, something like driver training, is important but intensive, certainly just a very small piece of the puzzle. As you see, clinical interventions, those typically, they are very important as well. Although they don't really have anything to do with preventing an occurrence, they're just managing it after the fact when it's too late. Long-lasting protective interventions have a long history in public health, things like immunization and clean water. An example here might be an ignition lock for someone who's been convicted of a DUI. Now, most of our health and transportation work that is emerging is taking place in changing the context to make individuals' default decisions healthy. So their examples here are just a fraction of many, many examples. At the design level, I know there are engineers here on the webinar, and you know well that people have default behaviors in relation to streetscape cues. Say that 10 times fast. It's the art and science of your impression. You know, you may flow and you control speed, you calm traffic, and other interventions, and people aren't really actively thinking about these, they're just responding to cues. And by definition, many of those support safety and well walking. And you probably haven't thought of it as health, but it is. Some policy decisions can also impact safety. Who is licensed with what qualifications would be an example. And then moving even more upstream, policies like pricing incentives, and other things like charging for parking, those get at the listing here where I have mode shift listed. Because the more people shift to active mode, you create safety in numbers at a level where you also get better health outcomes. So the bottom of the pyramid are the more structural changes that are challenging. A global example is maybe easier to understand that with the wealth of developing nations, you often see more car ownership, which precedes the infrastructure really catching up, and so poor road quality results in much higher levels of fatalities. But within our own communities here in Oregon, equity, income, and power are what come into play here. And if people are not at the table to advocate for safer neighborhoods, that's where those socioeconomic factors can play a role. We have a tagline in public health that is to make the healthy choice the easy choice. And we have many, many rules and regulations that we take for granted in the U.S., like we have iodine in our salt, vitamin D in our milk, we have treated water. And to use maybe a closer example, we have consumer product safety standards. So as citizens, we don't have to be consciously aware that someone else has ensured that a good or service is going to be safe for us. So the goal with this focus of this topic would be to move toward making safety an assumption for all users of our system. I have another type of visual here, pretty straightforward, but gets at the concept a bit differently, where public health people are trying to pass healthy policies, implement healthy plans, generate healthy designs so that we create the healthy places, which enable the healthy behaviors, which are what result in healthier people. So how does public health work in this context, as shown on the pyramid? We typically do focus upstream on things like policy, which can be a big P policy or law. It can also be little p policy, which might be commitments or criteria for projects or standards or practices. And there's many ways to slice and dice the concept. So these are really more for reference here. There are frameworks out there. Some are very broad, and they say things like consider safety. And I know for the public health audience, we're needing a little more information about what are some effective strategies without trying to become engineers. So from the public health side, there's a couple publications. Change Lab Solutions is a great resource for public health policy work. They have a framework of safe, accessible, acceptable, and convenient in their bike policy guide. And under each of those areas, they have 8 to 10 policies and policy options, which are just great. They have a combined pedestrian and bike guide, which is framed around safety, access, and comfort. So you notice that safety is #1 in both of those. So for the public health people, maybe what might be newer is the 5 E's, which is a little more in the safe routes to school and transportation world as a way to frame this work, looking at education, encouragement, enforcement, engineering, and evaluation. And up there's a couple guides. New York City has a great Safe Streets guide that's a little more engineering focused, but has some great before and after pictures of dozens of PED and bike treatments that they did. And they have also a framework of principles about making the street easy to use, creating safety in numbers, and so on and so forth. So the point here was just to share ways that public health folks can become a bit more conversant in some of the best transportation practices without feeling like you need to be an engineer, but know what a delayed interval signal is, or understand a little bit of street features that create walkability, or understand how a crossing program works and the legalities around that. And conversely, maybe the transportation audience here can become more aware of how powerful a driver the social and environmental context is for the behaviors that result in these health outcomes. So just briefly, as I only have a couple minutes left, to share, if you're wondering what those outcomes are, here's a look at the leading causes of death in Oregon. Clearly you see our safety topics show up here at #5 on the list. And I should say these are not only pedestrian or even all motor vehicle, but that is a large proportion of our unintentional injuries in Oregon. So just kind of hearkening back to my initial point in this presentation, safety shows up here too, to the extent that if we don't have safe communities, we don't have walkable communities. And if we don't have walkable communities, we have a lot of inactive people. And right now, about 20% of the population of Oregon is completely sedentary. And those are the people who we'd like to encourage to make active trips. So we see the shadow of physical inactivity here, and perhaps the lack of safety through cancer, heart disease, and stroke. You also see respiratory disease here, which would also be helped if there were more safety and more people shifted mode, our air quality would improve. And so by now you've heard me say pedestrian safety. It's a pathway not only to reduced injuries and fatalities, but has many other benefits. And we've already talked about most of those, with the exception of the last bullet there, about the high cost of transportation. People of lower incomes are disproportionate users of the PED and bike system, and if we can make that safe for them, that continues to be economical, as well as to our system, like our transportation system. And my last feel-good slide is, it just touches on the less tangible and less measurable. I'm a passionate walker. Some of the quotes here get at the joy of walking and the real community connections that it creates. And it's cheap for the individual, it's equitable, there's no lobby against it, unlike many public health issues. Those of us who work in areas like food policy or tobacco policy. There isn't really a lobby against walking. And it connects people to their neighborhoods. So let's create some more safety out there.
Okay, good morning. We're going to talk a little bit about data. I only have 6 slides, and so hopefully you can get just kind of the crux of what we're talking about when we talk about injuries and fatals to pedestrians. When we talk about injury and fatality data, we separate this category into those that were injured but survived and those that were fatally injured. The national data we will share today is from NHTSA, the National Highway Transportation Safety Administration, and the death and hospitalization data are both from Oregon. Hospitalization data is defined as those that were actually entered into the hospital with at least one overnight stay. This doesn't include emergency room data or EMS data where pedestrians may have been treated and released at the scene or treated and released in an emergency department. So when we say hospitalization and death, we're really looking at the kind of the higher end of our pyramid, kind of the smaller numbers. If we were able to add the other two, the EMS and the hospitalization data, we would actually have a better picture. It's coming. Maybe next year we can talk to you about that. And also, the data today only include those motor vehicle traffic deaths and injuries that occurred between a motor vehicle and a pedestrian. So in this slide, we're sharing 2 perspectives, what's going on in the U.S. and what's going on in Oregon. To compare the two, we used the latest U.S. data, which was 2011. So in the U.S., more than 4,000 pedestrians were killed and nearly 70,000 were injured. So for every death, there were about 15 people hospitalized. In Oregon, this number is close to the same. We average about 40 or 50 pedestrian fatals each year, and about 18 are hospitalized for every death. Nationally, pedestrian fatals account for 13.7% of all motor vehicle traffic crashes, and in Oregon, we're just about the same, slightly higher at 13.9. So our picture is very similar. And it makes sense that in large urban population centers, we have the most motor vehicle pedestrian interactions. Nationally, 75% compared to about 50% in Oregon of the fatals occur in the urban settings. And also not surprising, most motor vehicle pedestrian interactions are when pedestrians are crossing streets, either in intersections or non-intersections. Weather is generally not a factor in pedestrian fatals, but time of day is. Dusk, around the 6 p.m. hour through the evening hours, are the deadliest time, which makes sense due to visibility issues. So who's being injured? Here, Oregon and national data are a little different. Nationally, older pedestrians have a higher rate of death from pedestrian injuries. Factors might be that older Americans are slower through intersections, possibly have less muscle mass, and be more frail at impact. Our youngest population of children also has a specific risk. While there are definite child pedestrian deaths in intersections, backovers of small children to driveways and streets are also included in this category. And the child size does factor into whether they can survive an impact with a motor vehicle. But speed at impact is the key factor we really want to emphasize. The average risk of death for a pedestrian reaches 10% at an impact speed of 23 miles per hour, 25% at 32 miles per hour, 50% at 42 miles per hour, 75% at 50, and 90 at 58 miles per hour. So risks vary significantly by age as well. For example, the average risk of severe injury or death for a 70-year-old pedestrian struck by a car traveling at 25 miles per hour is similar to the risk of a 30-year-old pedestrian struck at 35 miles per hour. So slower speeds around school zones and in neighborhoods where there are more pedestrians isn't just good policy. There's the likelihood of saving lives with slower speeds. And finally, the discussion of alcohol involvement with pedestrian motor vehicle crashes is an important one. Alcohol involvement was involved in nearly 50% of the deaths nationally, and in Oregon that number is similar. This includes both drivers and pedestrians having some sort of a BAC of 0.08 or higher. And lastly, the risk factor that seems to get a lot of discussion is both driver and pedestrian distraction. We see that all the time. Drivers looking left to turn right instead of also looking right for pedestrians, and pedestrians looking at their phone walking through intersections, among other distractions. So this slide shows 13 years of data on traffic death rates in Oregon. And as you can see, the biggest dip we've had has been associated with the motor vehicle occupant deaths. As Oregonians, we have embraced wearing seatbelts and appropriately buckled up children in safety seats and booster seats, and the rate has declined substantially. And in fact, if you haven't already heard the news, Oregon has the highest seatbelt use rate in the nation. So big woo-hoo for all of us. And we should be really proud of this collective work. However, if you look at the other bars, we haven't really moved the needle at all, other than occupant deaths. Take out the orange bar, which is the unknown, and then you see the blue, the green, and the purple lines. And you can see that pedestrian deaths, the blue line, is slightly higher than motorcyclists and bike riders. And I think that might surprise people. So today we're really talking about two modes of travel we would like to promote for health and environmental reasons, which are bike and pedestrian. This slide also shows a comparison of rates between these two modes for those that are hospitalized now. Again, these are people who were hospitalized. These are not people who died from injuries. There's a slightly higher rate of cyclist hospitalizations, and the red line continues to dip up a little bit as the blue line for pedestrian hospitalizations kind of flattens out and slightly dips down, although it kind of went back up here at the end in the last couple of years. So I haven't actually talked to my colleagues here about why we think this might be, but one thing that came to mind when I was thinking about this slide today was that cyclists are often moving with the speed of traffic, and they wear protective headgear most often. We have a pretty high helmet use rate, especially in the urban areas where most of these occur. Pedestrians aren't ever moving at the same rate of traffic, as speed of traffic at impact, and they have no protective gear at impact in a crash. Two really distinct things. So then we're also looking at the distribution of age groups that died from pedestrian motor vehicle crashes. And this is actually a pretty fair distribution of deaths across age spans. But it does show that middle-aged adults are an age group that we should be paying attention to. So if you think about an urban setting, however, adults are generally those that are walking around for both work and for entertainment reasons. And lastly, this is the slide on 11 years of data for hospitalizations. And this looks really different than the death data. You can see that the 15 to 24 age group and the 45 to 54 age group both stand out. And in designing interventions with pedestrians, keep in mind these age groups. While we have a good amount of energy going to safe routes to school for children, and we have protected school zone speeds and slower speeds in neighborhoods, there really doesn't come to mind a special effort to target young adults and middle-aged folks on pedestrian safety. I think I might be a little ahead of time, so I'm going to go ahead and pass the baton to Ludwig.
We're passing a keyboard here, not a baton. Hello, my name is Ludwig Rahman. As you heard, I'm on the board and volunteer with Oregon Walks, and I'm also a transportation planner by profession. And as a planner, I'm going to talk to you about plans. So if you care about pedestrian safety, it's important that the steps you take for pedestrian safety are the most effective ones. And to do that, the best thing to do is to start with a pedestrian safety action plan. As a transportation planner, I've worked on a number of pedestrian plans and pedestrian elements of transportation system plans. At their most basic, they look at where the sidewalks are and where they're missing, and the plan is to fill in the gaps. When they get a little bit more sophisticated, they may prioritize the gaps by the number of people using the sidewalks or by access to destinations, but that's about it. As you heard from the data that we have, it may very well be that sidewalks is not the most important thing for pedestrian safety. In fact, one of the data points we just heard was that 75% of pedestrian crashes occur while crossing the street. So if pedestrian safety is what you care about, it requires a slightly different approach than if you're doing a basic pedestrian network or infrastructure plan. So let's talk about what that takes. The first step is to involve the right stakeholders and representatives, and that includes probably a bunch of people that may not be on your transportation system plan, citizen advisory committee or technical advisory committee. So it should include transportation agencies, but also health professionals, public health professionals, preferably emergency providers, representatives of other modes, because we do all share the road, and what we might do for pedestrians would affect other modes and vice versa. It should also include representatives of all incomes, age, genders, and abilities, because those characteristics affect our ability to walk and our perceptions of walking. And once we get the right people in the room, it's important that we spend some time getting to know each other's language and concerns. We tend to operate in silos. We do have different perspectives and interests. And we need to spend a little time getting to know each other and the words we use and the acronyms we use. Planners are pretty bad at that. But the good thing is that it is actually relatively easy to come to agreement about the importance of pedestrian safety and that enough is enough and we should do something about it. So that gets to the next step, is to define the goals, objectives, performance targets of the plan. Examples of pedestrian safety action plan objectives are to, for example, reduce the number of fatal and severe injury pedestrian crashes. Or you could set targets for reducing specific pedestrian crash types. That could be by age group, by certain populations, crossing, or school kids, or crashes that occur at night. Whatever is appropriate for the area we're planning for. So those are general goals, and then performance targets are where you draw a line and say, if we cross this line, that's not good enough. So an example of a target could be, we wish to increase the pedestrian mode share by 3 times, or to a certain %. Or we might want to achieve a certain number of walking trips. Or we might set a target for increasing safe access to certain destinations, such as schools or hospitals or senior centers. And we can do that for the population at large or for targeted populations, such as low-income, immigrants, the young, the old, etc. And we have pretty good technology to do all that, but it's really important that we agree on what it is we're trying to do with our plan. The next step is to collect local crash and roadway data to identify what's happening and then to identify the priority locations for taking action. So basically, to check whether the national and state data that you just heard about apply in your area, or whether the same trends are present. So the first type of data is crash data. And there are some limitations with crash data, specifically for pedestrians. We already alluded to that. Pedestrian crash data is pretty sporadic. Thank goodness
there aren't more pedestrian crashes. The number of fatalities in Oregon is 46 a year. So if you're looking at pedestrian fatality data, chances are you only have 1 or maybe 10 in your jurisdiction. So that's not going to tell you much about where to focus your efforts. The other issue with the crash data is that they may not show a pattern that gives you enough guidance for where to focus. What's not so obvious is that crashes only happen where people are walking. It doesn't deal with the perception of safety. And so the fact that there are no crashes happening on a certain road could be because it's just too dangerous and people know it, and if they can help it, they won't walk there. So again, it depends what your objective is, and if your objective is to allow people to be able to walk to a bus stop, for example, then just because they're not getting killed walking to the bus stop may not be the best way to identify that there is a need there. They're probably not walking, they're probably not using the bus because it's just too dangerous. So the other approach is to look at the presence of risk factors that contribute to pedestrian crashes in general as well as in your jurisdiction. And that requires looking at roadway and vehicle data as well as the actual crash data. The vehicle speed, the volume, the design of the roadway, whether there's illumination or not, whether there are signals where the bus stops are. So a bunch of data collection about the places where people walk or don't walk. And that can happen for a certain location, for a corridor. The city of Portland, for example, has a high crash corridor program. It could be for a targeted area or for an entire jurisdiction as an element of a transportation system plan, for example. And I want to encourage people, I work for the Transportation and Growth Management Program at ODAT, to include pedestrian safety action plan as part of their applications for transportation system plans or as standalone elements of TGN grants. Pedestrian safety audits are another method for collecting data. That you can only do that for a relatively small area. It's a great activity for volunteers and professionals to do together, and it deals with the issues of perception as well as the objective data. Next step, prioritize the locations and select countermeasures based on the data that you found. In part, that's a technical exercise, but it isn't purely technical. It's also political. It depends on how much money you have available, and there's a certain professional bias as well. As a planner, I tend to think that the solution for every problem is a plan. As an engineer, you might think that the solution for every problem is a roadway fix. So it's important in this step to keep everybody at the table and make sure that you do pick the right countermeasures that work for everyone, and not just because that's what we're really good at or tend to go towards. There's a lot of toolboxes available. There's information about what countermeasures are effective, but picking them is a choice that you have to make. And then the types of countermeasures, the next speakers will talk about those in more detail. This is an example of a map of priority sites for pedestrian actions. And as you can see, this is from the state of Oregon in Portland. The blue lines are the risk-based pedestrian project corridors, and the pink fuchsia lines are the frequent and severe pedestrian crash database corridors. So you can see they are not the same. The pink lines are where the actual crashes occurred. The blue ones are where risk factors are present that would lead to crashes if people were walking there. So there's definitely a lot of thought that needs to go into where you're going to focus your efforts. So you've done all that. Next step is to develop an implementation strategy. And typically, since we don't have unlimited money, it's a good idea to categorize our strategies into quick, simple fixes, the low-hanging fruit, into moderately complex fixes, and then the big projects that are going to take more time and money to do. Also think about developing a phasing strategy. There may be something you can do now and then something else you can do later, but every little bit helps, and any crash we can prevent now is worth doing. And identify funding strategies. And for those of you who are worried about liability, when you've done all this data collection and identified these high-risk corridors, having a plan, an implementation strategy that's systematic and fact-based really helps with that liability issue. As long as you can demonstrate that you have a systematic plan and you've identified your priorities and you've picked the most effective countermeasures, you should be okay with regard to liability. Step 6 is to institutionalize the changes to your plans, your development codes, your design standards. So that might show up in your comprehensive plan, in your transportation system plan as a policy, in your performance measures. You could adopt, you could have the jurisdiction adopt the performance measures that you agreed on. Your project lists, of course, are you going to spend money on the roadway fixes that you identified, but also your street design and your street connectivity standards and the development requirements in your development code and construction zone manual. And the whole idea here is to make pedestrian safety a routine consideration in everything we do. It should be the default. It should be even the people who didn't develop the plan and think about it, when they do what they do, it should just be automatic that they consider pedestrian safety in what they do. A couple more steps. Consider land use, zoning, and site design issues. Sheila's going to talk about this a little bit as well. The general idea is that in the design of our communities, we should make sure that there are destinations within walking distance that can be through a 20-minute neighborhood or transit-oriented development, and that they're accessible, not only that they're there, but that you can get to them on foot without having to cross a busy road of fast-moving vehicles or other barriers such as the river. We're almost there. Step 8 is to reinforce commitment to action, which is, again, another way of saying institutionalize pedestrian safety into the agency as part of the mission statement, develop a culture of safety, provide internal and external training, have awards for exceptionally good designs, and then support ongoing research in the effectiveness of countermeasures. And finally, evaluate the results of your actions. So always quantify and document the before and after conditions, and that's true not just for roadway fixes, but also your education and enforcement actions. And keep track of and publicize and celebrate successful projects and programs, and even not so successful projects and programs, for lessons learned, because we can all learn from each other. So that's it for my part, and we're moving on to Kim.
Good morning, everybody. My name is Kim Curley. I do community outreach in 9 Central Oregon counties, from Wasco down to Lake County, the less populated, I guess, side of the mountains. And I work with businesses and schools and other community members on encouraging commute options, which are biking, walking, carpooling, riding the bus, and telework. What we're going to talk about now are some of the strategies that can be used to increase pedestrian safety and even get a good glimpse of your current conditions in your neighborhood. The 5 E's in this instance are education, encouragement, engineering, enforcement, and evaluation. I like to think of education and encouragement as things that go together. When you're teaching students, say, in a bike or pedestrian safety class in school, a a really great encouragement tool is to go have them use that skill that they just learned, crossing a busy street at a crosswalk or using a pedestrian signal to get their turn. Go on a walkabout and actually encourage the use of walking after you teach the safety skills that are needed. We'll talk later in depth about engineering fixes that are physical improvements to the environment that you walk or bike in. We'll also talk more about enforcement strategies, partnering with our law enforcement to create safer driving habits in your community, and kind of getting the community on board with the stick method, maybe, is the way the enforcement works. And then, of course, for any good program to be able to be successful and to be shared, you want to evaluate that program and make sure that it's doing its job. And if it's not doing its job, tweak it so it is a little different. So what you'll see here is a visual of factors that influence pedestrian safety. And the smaller blue and green circles really only represent a small amount of pedestrian risks, I guess. So roadway factors, the way the road is built, and also factors with vehicles physically, only make up a very small amount of the problem. So the problem, as you can see, is us. The human factors, our behavior. Adrian was talking about at-risk pedestrians. It's older adults, and then a lot of behavior with drivers, speed of drivers, and impairment. And impairment can mean drugs, alcohol, or other distractions, and we all know what those are in our life. So really this is just showing that there are a lot of opportunities for us to influence the human behaviors that will keep our streets safe and increase the number of walkers in the community, which is why we're here today. So let's start with education. We also heard from Lidvine earlier that involving stakeholders is hugely important in this effort. And this is a list just of some stakeholders in Central Oregon where I live. And it may be a few unlikely partners, school districts or medical centers or even your farmer's market or the recreational activities that your kids might be able to engage in parks and recreation or campfire. You can enlist some help from your environmental partners, people who are trying to protect the air and water quality in the places we live. There's also the usual suspects like businesses, senior centers, homeowners associations. The library is a really amazing partner because they see so many facets of your community coming through the doors every day. The faith-based communities, churches, synagogues, schools. You can also go to stores or police and fire stations and ask for involvement from those partners as well. So we also heard earlier about the target audiences in your local area. I think we all can agree that a pedestrian walking across a dark street in a dark hoodie with dark pants on is probably less visible than someone who is maybe in a more visible location that's well lit or who is wearing different clothing. And I think nighttime happens all over the state, so that's something we can probably agree on. The older adults being more frail and having less of a chance to rebound from a crash can be a good target for you also. And then I think we really need to get serious and talk about drivers and their part in pedestrian safety. So when you're talking to pedestrians, you can encourage safe behaviors. These are kind of textbook things that are on every safe pedestrian handout, bookmark, and door hanger that you can find. Being predictable. I will always see a pedestrian looking at their phone, wandering out into a crosswalk, and I'm thinking, wow, you don't even know what's going on around you. We all kind of get in that little world with the smartphones now. So be predictable. Be in the place that you're supposed to be so drivers will not be surprised that you're in a place you're not supposed to be. When you're walking, walk on the left if there is not a sidewalk provided for you on the right. You want to ride your bicycle with the flow of traffic and walk facing traffic. Pay attention to traffic. And this kind of goes without saying, but look in people's eyeballs. If you've got a driver approaching you and you want to cross the street, try to see if they see you. It's a very basic body language that I think is underused. Drivers. There's a lot of messages for drivers. So being aware, looking out for pedestrians, looking right before turning right. Often we'll sit at a stop sign and look left until our gap is there and we don't look right. There could be a person standing on the side of the road. Slowing down, stopping at crosswalks. With young children, they can move across your path when you're backing up out of a driveway. So be aware of that too. So how do you communicate? There are all kinds of different ways to communicate these days, speaking of smartphones. Facebook and Twitter, websites are great ways to connect with people, but the simple flyer that has maybe an announcement for a community meeting or an open house. You know, we all live in the neighborhood, so wherever it might be that we do reside, we are, you know, traveling through other people's neighborhoods. So maybe go to a community meeting that's called at your local school or church and, you know, be heard. There are people who are interested in getting together and working on this. In fact, in Miami, educational posters were placed throughout the county at public places. And the posters explained that reduced visibility of pedestrians at night and the need for drivers to slow down was an issue in their community. So they got everybody together and talked about retro-reflective clothing, flashlights, and they did see a decrease in pedestrian injuries and deaths in that neighborhood several years later. Another great way to engage with the population who's walking in your community is to hook into Safe Routes to School. If you haven't heard of Safe Routes to School, I don't know, maybe you live underground, but almost a 10-year-old federal program that saw some data that said less than 10% of our kids were getting to school under their own power, and everybody was really sad about that. I remember walking home from school over a mile every single day in grade school, and it was one of the most fun times of my day, you know, so I could torment my sister on the way home. But what we've been doing is kind of taking down the barriers of parents who feel that they perceive that it is unsafe. So the Safe Routes to School program teach students in grades K through 8 proper pedestrian and bicycle safety skills. And there's in-class encouragement, in-class education, also encouragement events are held in the community. Having law enforcement and other sort of celebrities, you'll see Pelican Pete in the lower right-hand side. He's in Klamath Falls. He walks to school with the kids. It's super fun. And he's a mascot for the college there. So these events, they're the cherry on the sundae of the education effort. So you educate throughout the school year, and then come May and June, let's get kids out. Drivers will react better when there are more kids walking and biking on a regular basis. They will either go a different way or they will drive slower, which really helps prevent injury. There's a wonderful resource online, Oregon Safe Routes to School, OregonSafeRoutes.org. This is a snapshot of the cover page, and what you can do is click on the map on the right and see the existing programs that are in your area and the partners who are doing those programs. So this is another really amazing way to get data, because the Safe Routes to School program requires tally sheets be done in the classroom every year, and also parent surveys are sent home to ask about travel behavior to and from school. And this is really important because grant funding and, you know, specifically Pedestrian Safety Action Plan, you could use some of this data that's already being compiled and has been compiled for quite a number of years and see trends. You'll also see the barriers that are stated by parents, why they don't let their kids walk and bike to school. So this is a super good resource, OregonSafeRoutes.org. So, be seen. I live in the city of Bend, and this last winter we did a 5-event series of Light Up the Night. Nearly 1/3 of all pedestrian fatalities occur between 8 p.m. and midnight. And like Mom always said, nothing good ever happens after midnight. So we can make an impact by wearing bright clothing during the day and reflective materials at night. And there's some really cool things you can get and distribute in your community. We had some magnetic, it's called a Vislet light, and you can stick it on your backpack, on a hat, on your shirt, on a hoodie. LED, the batteries last forever, and the magnet's very strong. So it's one of those that really stays around. So developing a See and Be Seen campaign in your community, this is great for the pedestrian, but also heightens driver awareness. And it's a great way to engage community in your effort. I threw this in here to be funny, not to be scary. It's a lady on her cell phone and a man trying to walk in his pajamas to school with his children and his coffee. Sometimes the perception of safety in the very driveway of the school is pretty low for parents. So what we need to realize is that we are our own problem. So if this lady might park in the neighborhood and walk her kids in, or maybe hang up the phone, pay attention what she's doing in the driveway of the school, the perception of safety will go up and more parents will allow their children to access places by foot. The distracted driving issue is enormous and getting worse. And I think there are a lot of efforts to get drivers to pay more attention while they're driving. This is a community pledge website, which is national, so you could actually challenge or ask your community to take the pledge and make this a piece of your pedestrian safety action plan, that drivers will agree to slow down and pay attention, especially all the time, but especially in park and school zones where small people are trying to play. So how do you get the word out? You can distribute flyers. Again, you can put posters up at those community partners, retirement communities, senior centers. You can use a door hanger type situation where there's maybe a two-sided flyer that can be hung in people's doors or mailbox. You could even partner with some of the local media outlets and get billboard space. Have a campaign and get it out in your community. Pedestrian safety campaigns are pretty few and far between. I was doing research for this webinar and really had very few localized successful programs to choose from to show you guys. But there are a lot of successful biking campaigns and more now than before successful driving education campaigns. This is a bike safety campaign that came out of the Road User Safety Task Force in Bend. We got a small grant and created these posters, and these are for the top 3 ways that bicyclists in Bend were being hurt and killed. One is impaired riding, one is wrong way riding, and the third is the See and Be Seen. These are kind of in the public domain. The funding was from the state. So if you are interested in sharing some of this artwork or tweaking it even for the pedestrian factors that are in your community, just let me know and I will be happy to share it with you. Now back to Adrian.
We're into question and answer?
Yeah.
All right. Okay. It looks like we had 5 or so questions come in this first part of the webinar. The first question was, where could we obtain the statistics about the fatality risk factor vehicle speed correlation that I spoke of? That is definitely found in the literature everywhere, but NHTSA has that literature. I actually Googled it this morning and it popped up. Try NHTSA and then also just try Googling it. We had another question about, is there any data showing where alcohol-related pedestrian fatals and injuries occur And are they within a certain distance of facilities that serve alcohol? We're actually working on that question right now. We have a small little data group that is going to try and do some GIS mapping of where the injuries occurred and where alcohol restaurants and bars and such are located nearby. And so I don't think that the data is combined and out anywhere yet. We certainly have not found it, but we are going to be working on this. And if you have a particular interest in it, you're welcome to even join our little data group. So I guess the short answer is no. We don't have any data showing where it is, but we will at some point. Next question was, let's see. Can the grant funds be used to do a small improvement project? No.
The grant funds are for the other E's besides engineering.
Correct.
Only.
Signage? Is signage oval?
I think so. And then one comment came in when Kim was talking about looking at the driver in the eye and made a comment that with aggressive drivers perhaps making eye contact could exacerbate the situation.
Well, I'm talking about as a general practice of being observant of your situation when you are a pedestrian and you're looking to cross the street. I'm hoping that you're not in an escalated problem already with someone perhaps being angry that you're trying to be a pedestrian in their way. And I would certainly smile because looking at someone in the eyes and smiling is much more friendly than other kind of glaring type of activities.
And the last question is, what are the statistics on bike head collisions, bicyclists and pedestrians running into each other, and is that an issue? I don't know. You want to answer?
Yes, I can answer. There are no statistics. It's a crash type that is not required to be reported under Oregon law. It's not tracked by the crash data. The only crash data that is tracked and reported is that involving a motor vehicle. It would take, sometimes you can get it through hospital records, but you'd have to kind of hunt and peck and figure it out. There is no reported database for that. We tend not to focus on those types of crashes because in the area, when it comes time to spend money, we're going to focus on fatalities and permanent injury type crashes. And bike and ped crashes don't tend to fall in that category. It tends to be more minor injury. I mean, it can be severe, of course, but it's a rare occurrence. So that data does not exist currently.
There may be some local data available, especially for trails, and it's more anecdotal that those crashes might occur, but they wouldn't show up in statistics. The basic issue, like with a lot of crashes, is speed differential. A bike is just faster than a pedestrian, and the bike itself is an object that can hurt the pedestrian. So it shows up in trail design, the width of trails, and especially for two-way trails, expecting pedestrians, bicyclists, skateboarders, people with strollers to share 12-foot going in both directions is just not reasonable.
Since we're talking about data, this is Heather Grant from the Oregon Public Health Division talking. I wanted to put the call out there since you mentioned Lidvine local data. Yesterday, the Oregon Bicycle and Pedestrian Plan Update Technical Advisory Committee convened for the first time. And our leaders there were just kicking off the process. And one of the areas that I know that they are very interested in are any local examples of good data. It could be non-traditional data from the health system or other systems, not just the traditional EMS or transportation. Also looking at any innovations in local transportation system plans or comp plans that address bicycle and pedestrian, just some best practices from around the state. So I'm going to use this opportunity to put the call out there that if any of you in your local communities know of some unique, and even if they're just sort of pilots or samples, just some unique approaches to data collection or interventions, then if you would share those, my email will be, I know, on the last slide. So I'm looking at our moderators how we can get that out.
Well, we are sending out via chat, so we are sending you Heather's email right now on the chat screen.
Yeah, so any good examples of these kinds of questions in Oregon will help inform some recommended approaches potentially in that Oregon pedestrian bicycle, or bicycle pedestrian rather, plan update. So thank you in advance for anyone who can respond there.
So I think there was a comment versus a question, and the comment was, there are some data from university research in Canada that stated the bicyclists' perception of multi-use paths are that they are very safe. However, they are actually hospitalized injuries that occur in multi-use paths. And Emma elaborated and mentioned that it's the Teski bike, Teski, okay, great. Teski Bike Infrastructure Safety and Preference Comparison Study. So if you can't see that in the questions, we will also send that out via the chat. We still plan on going until 12:30, but we might just transition to Shelley's presentation, which will take 15 minutes, and then we will break after that and start up the next set of presentations at 1 o'clock.
Let me just exit out of this screen for Shelley. And someone asked if each person could introduce themselves.
All right, my name is Shelley O'Lear, and I'm the Bicycle and Pedestrian Coordinator for Washington County. I am an engineer and transportation planner, so I wear a little bit of both hats. But I'm talking about enforcement today because it all overlaps. So again, all the 5 E's, they all combine and complement to make the most changes in our environment and our behavior that we talked about. So enforcement, I wanted, right,
You just have to click on the screen first.
okay. All right, the role of enforcement is, again, to get out that the 3 circles we talked about is the behavior area. That is the big crux of a lot of our issues. So really, enforcement is about increasing awareness of existing laws and policies and practices, improve behavior, and also reduce traffic safety problems. And that actually can be done by targeting some of these major areas that I think are common that we've already sort of talked about. Some of the major driver behaviors that are of concern are speeding, red light running, particularly for pedestrians, what we call the multiple threat, where you have a multi-lane road where cars are stopped in one lane, but then the adjacent lane doesn't stop and pedestrian isn't seen and is hit. Passing stop school buses, believe it or not, this is still a problem that happens out there. Also, distracted driving, which is increasingly documented as an issue. Pedestrian behaviors, the most common that we see out there are disobeying signals and crossing at non-legal locations, and these are some of the issues that enforcement might want to target. So effective enforcement starts with understanding that the 85% concept, and that is that 85% of the people out there are usually doing the right thing in the right place, but there's a 15% of the population out there that are not. And those are really who you're trying to target to change their behavior, because their behavior is what is contributing to the safety issues out there. So what can be done? Enforcement, and this is law enforcement, can be effective in changing behavior up to 6 weeks. So actions that enforcement takes have that amount of impact. But then if there isn't any follow-up and consistency, behavior will return without any additional enforcement and follow-up and education. Engineering and education is part of that to keep that behavior change. It can be a very complementary and supporting element to making sure that there are changes, the changes in behavior become permanent. Most often you think about this is when you're with the engineering and education part of, if you're putting in a new type of traffic signal or a new type of treatment on a roadway, there's some education that needs to go with that and enforcement. Maybe it's a new rapid flashing beacon or something like that where you're introducing something new engineering element where education and enforcement are useful to make the full circle and make an effective change in the safety situation. So one of the things that we often don't think about is that the community members can really be a first step and often one of the least expensive steps to start looking at enforcement, community enforcement. This is one of those areas where peer pressure is a good thing when we're looking at safety. There's a lot of different programs out there. Engaging the community and discussing what the concerns are, the issues are, and actually informing them about the data about what contributes to safety, where they understand that it really is their behavior, the behavior of their neighbors, of themselves, that has the greatest impact on improving safety and the perception of safety. So here's some examples of the programs that are out there: neighborhood speed watch, yard campaign signs, pace car campaigns where you take a pledge to drive 25 in your neighborhood, which means that everybody else behind you has to drive 25. And then also looking at the school crossing guards, having volunteers participate in that from your community can be very effective. So law enforcement, that is what we traditionally think about when we come to enforcement. And that comes in 4 different approaches, 4 different points that contribute to that approach. Engaging the community and just discussing what the concerns are, what the perceptions is, educating the public about data, about what's possible, what is affordable, what we can fund, being realistic about that. I think the key one on here is actually providing officer training. Often there's so many things that our law enforcement officers are patrolling that sometimes they may not be totally up to date on all the pedestrian and bike rules and how to enforce them. So giving them training to give them confidence to issue citations is a really key part of the approach, and empowering them to become advocates for safety, bike and pedestrian safety. And again, lastly, of course, it's always evaluate and follow up to determine effectiveness and the most efficient use of resources. Some of the key law enforcement tools that are out there, some of these are active and passive. So some of the active ones are the targeted road safety patrol actions, which some people call stings, but targeted road safety patrol actions is the proper term. Diversion programs, this is where you might focus on some pedestrian behavior, not particularly bike, but you can do bike, pedestrian, or driver behavior, and you have programs that instead of finding somebody, they go to a program where they learn something about it. They do this often for seatbelts, and it's a way to get out of your ticket, but you also educate them at the same time and hopefully change some behavior. Doubling fines in some special zones, such as around schools. Progressive ticketing, this is often, again, very complementary to the education where you educate people about something that you're going to be doing this and what the proper behavior you want them to do. You get out there and actually issue warnings to people who are not complying. And then the third phase is that after you've educated and warned them, then you start ticketing people. Other tools out there that are actually fairly effective are these speed display signs. These are mobile trailers, or they're semi-permanent that can be moved around to various locations, and they have shown an impact on speed, again, a contributing factor to collisions and fatalities. So getting speeds to lowered. Also just setting up a traffic complaint hotline where people can report issues and perceptions about that will help all different aspects, whether it's law enforcement or engineering or education, to focus on maybe a particular neighborhood or location. Also, photo enforcement is not the most popular, but it is also one of those tools out there that is available to help support pedestrian safety. So just in summary, the law enforcement strategies that are available out there, that as much as you want to use law enforcement, also look at the community, because there's lots of valuable partners out there that can play lots of different roles in moving it ahead. And there's a lot of new strategies out there for enforcement that can improve behavior, and we're always looking for new ideas as well. So look to your community for what might be available and ideas that you might want to try and to evaluate to at the end to see whether or not it might actually improve a specific behavior that you're targeting. Enforcement works best when it's coupled with education and engineering. Again, all the 5 E's overlap into making the most out of our limited resources. And really, enforcement, as much as you would like to just make it as easy as calling the local police or the sheriff, it actually requires a lot of support from the community and media, that education element, to make the most of that effort.
All right, great. So we do have one more question. Maybe I'll just pose it to the group, and whoever has the answer can speak up. The question is, do you recommend any specific studies on the long-term effectiveness of permanently installed speed reader signs in school zones? Is anybody aware of that?
This is Shelley from Washington County. We have done the speed reader display both on the trailer and the semi-permanent where we move them. And so we have some of our own data that we've collected. There are a few studies out there. I don't know if they're specific to school zones, but what we found is that why we have semi-permanent locations for the speed reader displays is because rotating them, they lose effectiveness after about 2 or 3 months. So removing them and then putting them somewhere else in the neighborhood and then rotating them back through are the most effective. We found for that. Now, we haven't done the same data in a specific school zone, but that's something that we've found. I could look and see if we can find any studies. I have studies, but they're not. I don't believe they're in a school zone, specifically in a school zone.
Anybody else?
Enforcement strategy, this is Kim from Community Options. Enforcement strategies, like Shelley mentioned, are have a big impact for a short time, but then once the policeman is not ticketing people in the school zone for a couple of days, behavior goes back to how it used to be, which is that people are not going 20. So I think as a driver, when I see a speed feedback sign in a new place, I go, whoa, look at me, I'm speeding. So I slow down. But after I've seen it there for 5 or 6 times, driving by it, maybe my behavior has changed where I know it's coming, and then I am going slower so it doesn't shock me, flash. But I think moving them around is pretty effective, especially if you have the small pole-mounted signs now that are pretty easy to move. It used to be cost prohibitive to have law enforcement or public works move those giant trailers with a truck. You know, that was kind of something that no one had money to pay for. But those smaller signs seem to be a lot more nimble.
And it's a good opportunity to, we actually work with neighborhoods, and we just let them move them around. So then it takes away some work that the county has to do in moving those locations. We set up the permanent post holes, and then they just rotate them around the neighborhood to the 5 or 6 locations that we've pre-approved and designated.
And a lot of them are solar, so you don't need any infrastructure to do it.
Great. So this concludes our first session. We will start broadcasting again at 1 o'clock. If you have questions during the break, feel free to continue to send them in. But for now, we are pausing, and we will reconvene at 1 p.m. Thanks. Partners webinar. For the next hour, we have Sheila Lyons presenting on engineering strategies, and Adrian Green will talk about the mini grant opportunity. And at the end of the presentations, we will have a question and answer session. So if you have questions as we go along, feel free to type them in your question pane, and we will answer the questions at that time. So Sheila?
Thank you. I'm Sheila Lyons. I manage the Pedestrian and Bicycle Program at the Oregon Department of Transportation. And though I'm going to talk about engineering, I'm really going to talk about it in relationship to what enforcement and education efforts could be partnered with the basic nuts and bolts of roadway design and the legal aspects of crossing the street. Because, and one of the reasons I really wanted to get involved in this effort is because as Kim presented, engineering and roadway design have a role in the outcomes, the human behavior outcomes, but really some of the safety messaging and human behavior side of traffic safety is really underappreciated, I think, and not emphasized enough. So I'm hoping that as we go through the slides here, I want you to think about what would a education effort be around some of these topics and concepts, and maybe what an enforcement effort would be around some of these safety or these topics and concepts. And so this is very high level. I notice a lot of you are with engineering or public works departments. This is not an engineering design class. For that kind of detail, you need to take an initiative or institute? Initiative of pedestrian and bicycle innovation here at PSU, or a Kiewit Center class, or other class to dive into the actual design details. This is really just high level and really aimed at general public information. But there are other resources out there. So walkability is key, right, to a walkable community. You need to have a walkable network. Post-World War II, we got away from designing in downtowns with a rim of housing around it, and we got into this sprawled development along the auto corridor, segregating land uses, and then we go put the school out in the cornfield, necessitating that every child be driven to the school, and the result is these auto-dominated landscapes that are ubiquitous, right? You can't even name what town this is. You know, you'd have to look at the trees and say, well, it occurs in the northern climates, but that's the end of it. There's nothing distinguishing this town from the next. And crossing the street in this type of environment, as we've seen from the statistics, becomes very problematic. Another outcome of this type of environment is very habituated driving patterns that tend to degrade the walkability of a community, and I'm going to talk about that a little more. And we've seen some of the statistics on that. So we have figured this out. We realized that these sprawled along the highway communities have very high driving rates, very low walking rates. The statistics are that 40% of trips are under 2 miles. And that's a very bikeable distance. It's certainly a walkable distance, reasonable walk. And there's a large percentage of those trips that are an easy walk, a quick 10, 15-minute walk. And if we looked at transportation like we look at any other utility, we would be all over capturing the maximum number of walking trips so that we could maximize the capacity and efficiency of our network. And the fact that traffic engineering is practiced based on motor vehicle measurements only is a large reason of why we get what we get. And if we just changed what we measure, we would have very different outcomes. Walkable development, provides transportation for the largest number of people. 30% of the population doesn't drive, either due to age or inability. We have fewer auto trips, of course, in the walkable environment. Improved walkability seems obvious. And it's easier to serve transit. And then, of course, sustainability is improved by walkable development. And by walkable development, I mean having commercial centers that that connect to residential areas within a reasonable walking distance. Many of you probably heard about the 20-minute neighborhood, and that's the idea that nothing should be farther than a 20-minute walk away. And that's the kind of neighborhood, that's Norman Rockwell's America, right? Is that 20-minute neighborhood in many ways. So as we have, one of the keys to walkability and interconnected networks is street connectivity, or I like to think of it as walkway connectivity. Sometimes it's not always the street. And as you get a more connected network, your destinations are closer together, that you can take a direct route. When you've got a less connected network or an unconnected network that was very popular, I have to say, in the 70s and 80s when I was growing up, you wind up with having to take all trips and they have to go to the same streets, right? Every single trip out of the neighborhood on the right accesses the exact same streets for every single trip, and those streets become clogged and filled with traffic. It also, then you wind up having to make a bunch of left turns on a big, heavy, busy street, and so what happens? People decide they can't let their kids walk to school. In an interconnected street network or walkway network, you also wind up with more streets, but they're smaller in cross-section. And this is critical to pedestrian safety, as we'll see. And as you get a less connected network, you wind up with those big arterials that every trip needs to use, and they could just become monsters. It's not really. This is due to the fact that the only inputs really are motor vehicle measurements. So safety is definitely correlated to the width of the street. The wider the street, the more complicated the crossing maneuver becomes. The more nuanced you have to be in selecting a gap. And so as we build more connected, better connectivity, we get smaller street cross-sections, then the entire network safety goes up, not just for pedestrians, but for all users. Speed matters enormously, and this, hint, hint, nudge, nudge, would be an excellent topic for education because there's a lot of chronic speeding, and I think it's a cultural norm to maybe know the speed limit and then say, well, I can drive 10 miles over that. And it has an effect. It has an effect on a driver's ability to perceive the environment around them, perceive pedestrians, and stop for them. And it has an effect on crash severity. At 20 miles an hour, a pedestrian hit by a motor vehicle has a 5% chance of fatality. At a mere 40 miles an hour, and think about how many commercial districts, schools, etc., regular locations in your community where people access those things regularly are on 40-mile-an-hour facilities. Well, is that a walkable network when you have to cross that street? You have an 85% chance of a fatality if you're hit at 40 miles an hour. And 40-mile-an-hour facilities often in urban settings are often, that's where you start to get the wider roadways too. So street connectivity does not have to be limited to the streets, or I would say walkway or walk network connectivity does not need to be limited to streets. There can be all kinds of informal connections, and there's actually a researcher at the University of Oregon who studied walkability in the suburban Atlanta area and the suburban Portland area. And the street networks in Atlanta were less connected and the walkway networks were less formal, but the walking rates were the same. So people are finding those informal connections to connect to the shopping center, going through the backyard or along a neighbor's fence to a gate that's left open for them. And so I think that humans are naturally attracted to walking. So good walkability, you would think sidewalks, right? That's the de facto assumption typically. And you don't always need sidewalks. You can get by on quiet streets, mostly residential streets, low speed and or low volume streets. You don't necessarily need to build sidewalks, which if you look at your roadway network from that point of view, then suddenly it's not a big construction project that you need. Sometimes you might just need a mapping project to point out where these networks are. Along busier roads, you certainly need sidewalks at a certain point. Rural roads can be served by the roadway shoulder, and or on very low volume roads, just the actual 24 feet of asphalt can be the walkway. There's just low traffic volumes. You hear the car coming, you step out of the way. It can work quite well. You do have to pay attention to issues like sight distance, but for by and large, the shoulder and or the travel lane itself can serve as the walkway in a rural setting. So when you're going to do sidewalks, they have to be the proper width. They have to be clear of obstacles. And this is something we fall down on a lot. I had a phone call yesterday from a woman, a disabled woman, and there's a fire hydrant in her path, and she can't get around it. So that's a very common issue. Smooth surfaces benefit the largest number of users. Separation from traffic will attract more walkers than sidewalks that are shoved up against the travel lanes. And, of course, they have to take you where you want to go. So one of the ways to ensure that your walkway network or your sidewalk system has the maximum walkability quotient, there isn't really a quotient, but is to think of this, the sidewalk in terms of zones. You have the curb zone where people park. Then you have the furniture zone, and this is the critical piece of the sidewalk. You have to have the furniture zone. That is where you put the fire hydrants and the street trees and the signs and the parking meters. Then you have the pedestrian zone. That's where the people walk. And then you have the interface with private property called the frontage zone. And this exists regardless of context. So even in suburban residential, you will have all of these zones. And this street, this sidewalk, you can imagine if all of that stuff, the power poles, the real estate sign, the speed limit sign, the fire hydrant, if that furniture zone was not there, it would be clogging the pedestrian zone. The pedestrian zone becomes the furniture zone when you don't allow for a proper furniture zone. So fight for the furniture zone. It's the unappreciated piece of the sidewalk, and it's really the closet of the street system. And it's more obvious in an urban setting, right? The zones are really pretty apparent. Setback sidewalks also improve ADA compliance quite substantially, because at every driveway, you don't have to make up the great difference across the sidewalk. You can keep the sidewalk level. And people in wheelchairs are already at a travel disadvantage generally, and we confound it by not paying attention to these details. You don't have to have curb and gutter in order to have a sidewalk or a walking area. You can put it behind a ditch or a swale. And in smaller communities and more rural communities, this is an excellent option. Very inexpensive to provide this type of walkway. As the data, the safety data has shown us, really the crux of walking is crossing the street. And I think this is also an area that there's a lot of upside potential for us to start paying attention to the frequency of pedestrian crossings that we provide, the quality of them, and the level of infrastructure that's provided. Pedestrians get hit at signalized intersections, right? We give them the walk signal, but we allow a protected left. And we know that driver behavior is not really great. There's a lot of messaging that is we could do around this topic, and I think that some of these mini grants crafted around some of these driver behaviors around looking for pedestrians, where to look for pedestrians, checking for pedestrians before you turn left would be all the excellent messages, and then looking right before turning right. So pedestrians are getting hit when they're in the crosswalk, when they're at the signalized intersections, when they're doing what we tell them they should be doing, they are getting hit because we're not locking out the left turns, and we have a lot of bad right turns before drivers never look for the pedestrian. They don't even check. So legally in Oregon, the crosswalk is the extension of the footpath. So where pedestrians would logically walk, regardless of whether there's a sidewalk or not, if you extend that path through the intersection, that is a legal crosswalk. No paint is required to have a legal crosswalk. Every single street intersection is a legal crosswalk. Pedestrians have the primary right-of-way. Motor vehicle driver have the responsibility of stopping and staying stopped until the pedestrian has cleared their lane plus 6 feet into the next lane. And it gets more complicated, but that's the 101 of it. So this is another messaging campaign that would be really well partnered around just alerting drivers that their legal responsibility is to stop, and that means every single intersection, not just the painted ones. At a T intersection, likewise, there are 3 crosswalks, not 2. There are 3. We mark crosswalks in particular because we have done the engineering analysis to say this is a pretty good place to cross. You've got good sight distance. You have origin and destinations that make sense here. So we mark a crosswalk. It indicates to pedestrians where to cross and indicates to drivers where to expect pedestrians, although, honestly, drivers should expect pedestrians at every intersection. We used to have to make the case that pedestrians were actually out there and needing and wanting to cross the street, and I'm happy to report that in my career at ODOT, that seems to have changed a little bit. We now recognize that pedestrians really are legitimately out there, and we can expect them. They're going to cross where it's most convenient, and it may be contrary to the signalized intersection. Drivers need to understand pedestrians' intent. And on the engineering side, the way we help with this equation is we minimize the crossing distance, we simplify the crossing, and we do traffic calming so that we have some speed reduction. I get a lot of phone calls from the public where they want a crosswalk, right? They want a marked crosswalk, and these days you can go on Google Maps and figure out, ooh, no, we're not going to do that there, because there's really bad sight distance here. So this community really should do a little study and figure out where the better places to cross are, and a pair of crossings that might bracket this curve might turn out to be a better choice than trying to cross in the curve where sight distance is bad. So you do have to do your due diligence on the engineering analysis before you mark a crosswalk. These types of streets, of which there are many in Oregon, it's very difficult to figure out what the generators are, what the origin and destination. There's diffuse origins and destinations. And instead of sending people all the way down to that signalized intersection, they're going to cross mid-block because it shortens their distance, and in actuality it's probably a safer choice. Crosswalk markings are evolving. We used to do the parallel stripes. We are now doing what's called continental or piano keys, mainly because it improves the visibility of the crosswalk. It matters to some extent what the pedestrian sees, but what it really matters is what the driver sees. And the driver isn't really seeing much in a worn-out parallel marking. You're much more likely to get good visibility with the continental style or the piano key style. And you can stagger the markings so that they avoid the wheel tracks so that they last longer, and those are all strategies. I also hear a lot about from community members that they want to, they see the crosswalk as like the chance to decorate, I think, their community. And it's very frustrating because really it's not the place you should be decorating. You can decorate the furniture zone. Get a good furniture zone and decorate away. Knock yourself out with the art. Stay away from the crosswalks. Pavers are not a great idea in crosswalks because the texture is hard for some people. Someone in a wheelchair who's at their most vulnerable, crossing the street, they're already lower to the ground, a little less visible than an upright pedestrian. And then we compound it by putting a lumpity-lump ride through it. Walkers, canes, people who drag a foot, all of this, they're disadvantaged, so we should not be putting this stuff in the crosswalk. If you want more information on the safety effects of marking crosswalks, this is a study you can dive into and knock yourself out. Basically what this is saying is that under 10,000 cars a day, you can put paint out there and it's fine. Above 10,000 cars a day, you need something more. We minimize the crossing distance with curb extensions. This shortens the time the pedestrian is exposed to traffic, and if you're at a signalized intersection, it will shorten the pedestrian interval. Curb extensions improve the visibility of the pedestrian. The pedestrian can now see traffic coming and traffic can see the pedestrian. In locations where we've done curb extensions at a stop-controlled intersection, stop compliance improves because suddenly the stop sign is located not behind the parked cars, but out at the edge of the parking lane where drivers can see it. It shortens, again, it shortens the ped phase, it signalized crossings, and it can be a really simple solution to crossing the street. Median islands are the message. Median islands reduce pedestrian crashes by 40%. Medians and curb extensions are really the safety features. The paint is just a communication tool. It's the median that's the safety feature. And so that's why we fight for the medians. It can be difficult. People can oppose it. Business owners will say that they can't have left turns will be eliminated if they have the median island, but you can work through all of those issues by adjusting the location. You can add rapid rectangular flashing beacons, which is what is circled in this photo, and those can help induce a gap in traffic, but they do not necessarily improve the statistical safety of the crossing. It's the median itself. And the reason a median improves safety is because it breaks the crossing up into two discrete steps. You cross one direction of traffic at a time, you reach a place of refuge, you cross the next direction. And this is particularly helpful for children and elderly who take a little more time to cross. And if you add push buttons in the center, then you can go through 2 cycles of the light if you're at a signalized intersection, and you need to do that if you're walking particularly slowly. And medians come in all shapes and sizes. They don't have to be particularly large. We recommend a 75-foot perimeter footprint as the minimum size of a median. That's pretty small. And personally, I can't fund enough of these. I've probably funded hundreds of them in Oregon alone. One of the things we've already learned is that pedestrians are hit at night, not surprisingly, at dusk. And so lighting becomes really critical. I know that the Region 2 Traffic Office at ODOT will not approve a marked crosswalk unless you provide the proper lighting, which I think is the direction we should be heading in an engineering community. So interestingly enough, this is just a little detail, but it's an important one because when you place the light directly above the crosswalk, what you're illuminating is people's heads as they cross the street. But if you offset the lighting from the crosswalk to either side, then you're illuminating the side of the body, which is what you really want. And so lighting in general is important, but getting it right is equally important. And so if you're doing a walkability study as part of maybe your mini grant, that would be an interesting aspect to do, is to do a nighttime walkability study and see what, maybe there's a better location to cross because of nighttime lighting. Maybe the daytime crossing location should be different than the nighttime crossing location, and you can figure that out and provide that information to your community. Pedestrian scale lighting provides a nice ambiance, a sense of safety, and is a great place to expend your decorator instincts, right? Go out there and choose the lighting. Stay away from the crosswalk material. Street trees provide shade. They provide a buffer from the traffic lanes or the parking lane. They provide, better air quality. They have a lot of wonderful aspects to them. The important thing to remember is that they go in the furniture zone, not the pedestrian zone. Guide signs are an underappreciated aspect of walkability. People need, if you do a walkability, if you just walk around your communities, I urge every single one listening to this webinar to take a walk around your community and pay attention to some of these details. How do you know where you're going when you're on foot? If you're on a one-way street, can you see the street signs? Are they all oriented towards the one-way motor vehicle traffic? Are there destination information? One great aspect of guide signs is you can add time or distance information, which can help people realize that it's a 10-minute walk, not an overland excursion, and they're more likely to take that walk if they say, oh, 10 minutes, well, I could do that. So street art it just makes it more interesting, right? Dresses up the community. Another decorating opportunity. Walkability and transit go hand in hand. There is no such thing as a transit trip without a walking component to it. And partnering your street crossings, your street amenities with your transit stops is an excellent way to start tackling walkability in your community. Every transit trip involves a street crossing, and so it's a really great way. And actually in walkability studies, to determining if the bus stop's really in the right location for good walkability, sometimes crossing or bus stop locations can be adjusted without impacting the route negatively. And just paying attention to that stuff has a lot of value to walkability. The Americans with Disabilities Act comes into play in walkability. The U.S. Access Board sets the guidelines and the standards for ADA compliance. There are two sets of standards. There's the original adopted standard, the ADA Accessibility Guidelines, or ADAG. That was primarily focused on buildings and entries to buildings, basically parking lot to building, and then in the interior of buildings. It didn't make a lot of sense in the street right-of-way, so the Access Board came out with the draft Public Rights-of-Way Accessibility Guidelines. And those are still draft. They've been in existence for probably 12 years. Unfortunately, they're still draft. But they are the recognized state of practice. FHWA and the DOJ have endorsed them. If you're practicing, if you're in public works or engineering and you are practicing in this area, your guide is the Public Rights-of-Way Accessibility Guidelines, not necessarily the ADAG. In the sidewalk environment, it's a 4 foot by 4 foot by 7 foot tall clear passage. This is where the furniture zone becomes so important. Without the furniture zone, it can be very difficult to meet this. If you have a 6 foot curb tight sidewalk, you mount your signs 18 inches off the curb. If you have a 5 foot curb tight sidewalk and you mount your signs 18 inches off the curb, you're not going to make this standard. If you've got a 6 foot, you will make it, but just barely. So, and then these are the 6 principles of ramp construction. I won't go into the details here. Interestingly enough, the slope of the ramp is less important than the fact that there's a lip at the bottom. There should be no lip. And the slope differential between the street and the ramp is one of the biggest barriers to wheelchair access. As we go through and we overlay streets again and again and again, the crown, for those of you who understand that, it's the slope of the street, the parabolic shape of the street. As that meets the curb ramp, if that's at an excessive slope, then the foot pads of a wheelchair will hit that street before they can get up and over that hump, and they can't use it. And that's the end. That's the world's tallest man on a bicycle. So as you know, that's kind of the engineering side of walkability. It's high level, but there's a lot of enforcement and education messages that could be crafted out of how pedestrians cross the street, what's drivers' responsibility, and walkability assessments that look at, well, just because we drive from point A to B along a certain route doesn't necessarily make that the best walking route. And so you can oftentimes really find really good walking routes by just looking at your community from a new vantage point.
Great, thanks, Sheila. We do have one question. I think maybe it would be best for you to answer that before we move on to Adrian.
Sure.
And the question is, Springfield has decided to do different crossing markings, 2 stripes versus Continental, depending on whether or not it is a school crossing or whether it has a stop sign or not. Is this standard across the state?
No, it's not standard. I think the standard minimal requirement, there's like an entry-level requirement for a marked crosswalk, and that's 2 10-inch parallel markings that, you know, basically define the perimeter of the crosswalk. Beyond that, it's all optional. And communities do make a bunch of different choices in this area. I think if you're using parallel markings, they're less visible. If you're using perpendicular markings of any kind, they're more visible. I know ODOT standards are for continental in school zones, parallel markings in non-school zones. I think we're trying to move towards just universal We should be, you know, we never do this. Well, we should really be using the most visible thing we know how to use, right? It makes sense, but there's many ways to do it.
Great. So now we have Adrienne Green from the Oregon Health Authority. You can hand the controls over to her. She will be talking about the mini grant opportunities. So the culmination of all of these presentations will hopefully help you to apply for these opportunities. Oh, that's okay.
Oh.
To do this again.
Oh.
Yeah.
Okay. Okay, so the mini grant opportunity,
The right arrow.
okay, there we go. The mini grant opportunity, we're going to talk about all of these eligibility criteria over here on the left a little bit. So who's eligible to apply for a mini grant? You need to be a governmental organization or a 501c3, not an and 501c3. So you can be kind of any of those examples up there, and there's other examples, but any of those would qualify. However, there's a caveat. We would like you to have had experience working in pedestrian safety, and that you have the existing capacity to make progress within the one-year program period, and that you can commit to participate in at least one local training conducted by this particular action team that's been presenting this today, and commit to participate in the Safe States-led impact evaluation activities through March. So the purpose of the mini grant opportunity is to really advance an existing safety plan or policy or a transportation plan or policy. So play type, I think that means plan type is flexible. I think that originally Safe States wanted everybody to have pedestrian safety action plans, and there are no such things in our state. So existing safety plans or transportation plans are acceptable. And the outcome is to really assist in moving your pedestrian safety activities kind of along, move them along. This little shot of money will help move the progress quicker. The amount of the grants, we put a $9,000 maximum in here, and we don't know how many people. We are going to do a little quiz here in a minute about how many people are thinking of applying for the grants. But right now, the budget is that we probably will do award 4 grants. Clearly, that would change if we only had 1 applicant or 2 applicants. And then the activities of the mini grant is to really do these 3 E's: education, enforcement, and evaluation. However, Safe State says if you're going to do enforcement, you also must conduct another one of the E's. So for example, you can conduct education, and Sheila talked about several things that you could do to support new infrastructure projects. You can improve your data collection and analysis of pedestrian crashes to identify trends, high-risk populations, high crash locations, even do walkabilities, as she said, walkability audits of nighttime crossings versus daytime crossings. You can conduct educational campaigns focused on your high-risk groups or high crash locations. And you can also use the funds to evaluate a program or a policy or an infrastructure change that intended to reduce pedestrian injuries. So again, really, the mini grant funds are primarily for education and evaluation activities in support of an existing safety action plan. You can coordinate with enforcement efforts, but you can't do enforcement only. I believe there are other ODOT grants that are for enforcement only. So here are your mini grant facts. It's released today. It's going to be due at the end of July. We're hopefully going to award it September 2nd with the completion of the project in July of next year. But the evaluation will continue on for almost a full year after, about 9 months after, into 2016. And the application is available on this website. And a couple of other things about what you can fund in the mini grant. You can fund staff time. It's got to be additional and new, no supplanting. You can also use the funds to do a training or a meeting. You can use the funds to consult, hire a facilitator, buy pedestrian counters that are then retained by programs. You can use media and graphic services. You can use the funds for public service announcements. And what's not eligible is equipment, construction, engineering, paid advertising, food and drink, and incentives or promotional items. For anybody who's ever had an ODOT grant, it makes sense. We don't fund those things on the federal level anymore. And here are resources to assist you help you figure out what you want to do. These aren't the only ones out there, but certainly these are some good resource lists of how to do an action plan or background information on safety benefits of sidewalks, walkways, and then of the medians and the pedestrian refuge areas. And I think that is it. These are the contacts for questions from this presentation today. You can email any of those people. And I think that's it. Do you guys have anything else you want to add to the mini grant opportunity? Nope.
Well, just to say that I think we said in the beginning that, this is Heather from the Oregon Health Authority talking, that this Safe States Alliance, this DC-based group that got the funding from NHTSA and the Centers for Disease Control, this is really their first attempt at this kind of approach, and it's more or less a pilot. And so a lot of the evaluation, and by the way, I don't think it's going to be a big burden on the grantees, but the evaluation findings, I think their hope is that it will inform scaling up. And so whether that means there would be additional funding available in the future in Oregon or other states remains to be seen, but that is the hope. And also I think with transportation and public health coming together in Oregon, there's just, there are people who are eager to see this project as a demonstration and see how effective it is, and people who may be looking to supplement in ways to try to continue to advance this type of focus in Oregon moving into the future. So if you're interested at all, throw your hat in the ring for the mini grant, and then I would say stay tuned, and we hope to do more in this area in the future.
So we do have two questions. The first one for you, Adrian, is this an annual grant opportunity?
I think that Heather just mentioned that this is the first time that Safe States has done this, and only 4 states received the grant funds, and so the answer is no at this point. Possibly, maybe in the future, but right this minute, no.
And then what can we learn from other states or other countries that have lower pedestrian accident rates? Can anybody speak to that?
Really, I think that one of the benefits of this approach, and one of the opportunities here, is to kind of have some realistic talking about the way we drive and how much we drive and how much we rely on driving. Because if we're serious about pedestrian safety, that's usually the equation that has to change. We have to be less reliant on driving and appreciate walking more as an essential element of transportation, particularly for the large majority of trips that are short, you know. And so the countries that are really making progress on reducing traffic fatalities are putting driving in its rightful place, I have to say. And I think we're a ways away from that in the United States. But this type of grant opportunity that's focused on education is an opportunity to kind of start talking about, well, driver behavior and pedestrian, the utility of walking and walkability and the needs. So I see this as a first step in our learning curve there.
And this is a very different approach for NHTSA to take the highway side, for them to talk about the other E's besides engineering. I think there's been a light bulb that's gone off all over the country with funding that we can't engineer our way out of the safety issues that are in our communities. And so a lot cheaper way to address things is the other E's.
One thing I wanted to add to that, and I don't have statistics at my fingertip, but being from another country, the Netherlands, where there's a lot of walking and bicycling, there is safety in numbers. And I think there is data available that shows the more people walk and the more people bike, the safer it is. Crash rates don't go up with numbers of people walking or riding, they go down. And part of that is because you're more visible, it's the critical mass aspect. Part of it is that the more people walk and bike, the more drivers are likely to be walkers and bikers some of the time. So they're more aware of that there are pedestrians and bicyclists that they share the road with.
Okay, we also have a question about, you'll send us a link in today's slides, yes? And we will be sending out a link to the slides after the session, so once we post it to the website. And then the last question is this team available to host training in local communities and or provide technical assistance?
Mm-hmm. Hi, Ruth. Ruth is part of the team. She's not here today.
Well, let's Heather, I'll take a stab at that. If you're selected for a mini grant, part of what you receive is in-kind technical support from our team, which is engineers, education experts, public health. So we would be visiting your community to develop some kind of customized technical assistance or support, and are kind of available to you at your disposal, within reason, I suppose. But that is one of the things that the funded communities will get over the next year.
Since we seem to be losing a couple of folks and we want to ask our last question, I'm going to launch our last poll. Please, one thing that we want to know is, are you planning to apply for a mini grant? Please select yes, maybe, or no. We'll keep the poll open for a few moments. Okay. So 72% have voted, 74%. Okay. I'm going to close it, and I'll share the results. So it looks like 17% said yes, 31% said maybe, and 52% no. And with that, that concludes our webinar. Thank you so much to all of our presenters today for providing a lot of useful information regarding pedestrian safety. And we look forward to seeing your mini grants.